First, though, new data obtained by BBC Newsnight shows the number of mental health-related incidents recorded by the police in England, Wales and Scotland has increased significantly over a 5-year period. It's believed police officers spend 20 to 40% of their time dealing with this type of call, and some of them feel they should be spending more time dealing with what they call, quote, real crime. Merseyside NHS Foundation Trust provides a triage vehicle in Liverpool to attend calls with a nurse and a police officer. The Newsnight's UK editor, Seema Katecha, was given exclusive access to the team. She's been telling me more about the findings.
So we submitted an FOI to 48 police forces across Great Britain. 21 responded in the allocated time, and all of them saw a significant increase in the number of mental health incidents recorded over a 5-year period. So from 2017 to 2022, they gave us individual data per year, and each force shows how that's gone up throughout those 5 years. So, for example, North Wales Police showed the biggest rise. It went from recording more than 700 incidents or so in 2017 to almost 4,000 last year. But the caveat is it's not clear how individual forces recorded that data, or what definition of mental health incident they went by. But having spoken to some police chiefs, they think the increase is down to people increasingly turning to the police in the midst of a mental health crisis. So you think of people who might be self-harming or might be on the verge of taking their own life. Some will call 999, and police feel that's increasingly becoming the case. They also told us that they think a lack of community care for a growing demand for mental health support is also why they're attending so many incidents.
Well, we can talk now to Owen Winsland, the mental health triage car team manager in the urgent care division at Merseyside. Morning to you, Owen.
Morning.
How did this relationship with the police come about?
I think around about 2014, there was a national pilot, various forces, together with different NHS trusts across the country, adopted various different models. The model that Merseyside and Merseyside Police adopted was the model that we've got at the moment, that we've been running since then. So it's a nurse. Well, it's a mental health practitioner. So not all of my team are nurses. Some of them are social workers. Some of them are learning disabilities nurses. They work in a vehicle with a police officer based at Edge Lane Police Station, reviewing police logs, identifying which ones have got a mental health component, identifying how we can best support somebody to free up response officers to deal with, as the police say, kind of regular police jobs.
What sort of incidents do you respond to?
I mean, it can be anything. From the extreme end, you might have somebody down the docks who is considering taking their own life. People ringing up with a concern for safety for somebody. Somebody who's really quite lonely, who kind of rings 999 because that's the only way that they get any contact. We could go to any of those.
Do you think it's become busier in the last few years?
Oh, definitely. Yeah, definitely. I mean, certainly since COVID, the cost of living crisis, various things. We know that things like stress and social isolation will negatively affect people's mental health. And I guess COVID followed by a cost of living crisis is just that example, isn't it? It's the way it is.
I know you can't quantify how much you've helped, but does it feel like you've really been able to make a difference, do you think?
Absolutely. I mean, we've seen the number of jobs that we attend grow. We've seen the number of Section 136s that we've been able to avoid, or we've been able to put better plans in place to prevent people from going to A&E, to help them to stay at home. We see those numbers increase regularly. So I think we're definitely making a really positive difference to the city.
And I mean, in terms of how the relationship works with Merseyside Police, would you describe it very much as a partnership? It's not one body telling the other what to do, is it? It's about working together.
No, absolutely. It's entirely about us working together. I think that the pressures on finances across kind of a number of different organisations mean that we've got to work in a different way. We've got to work creatively. We've got to work together. And I think that the partnership that Merseyside Police and Merseycare have developed is a really good working example of that.
Do you think more forces should have a relationship with a specialist healthcare provider like the one you have with Merseyside Police?
Yeah, absolutely. I mean, I think a lot of forces have adopted a similar kind of model to ours, but I think it should be a national. I think it should be a national service, really.
Yeah,
Yeah.
because I mean, I don't want to, exaggerate too much or be too dramatic, but it feels to me like this country is facing a mental health crisis at the moment. Is that a fair summary, do you think?
Yeah, I think so. It's that combination of the more we know about mental health, the more we see people with mental health difficulties. But as I said earlier, I think with the cost of living, with the hangover from COVID, that sort of that social isolation, that increase in stress upon people, it all leads to people suffering with poor mental health.
And just before you go, just if you can tell me briefly about some of the help that Merseycare offers in general, because I think it's important that people know that you are there if they need them.
Yeah, absolutely. I mean, the first protocol, if somebody is feeling that they're in crisis, is that there is a crisis number, which is a 24/7 number. It's a free phone number. So if you're in Liverpool and Sefton, that's 0800 145 6570. And if you're in Halton, St Helens, Warrington, or Knowsley, that would be 0800 051 1508. There's also other services. So you've got the Life Rooms is in various different parts of the city. That offers a variety of different services, kind of access to CAB, um, employment advisors, support groups. And if you just put that into your search engine, Life Rooms, it'll show you where the nearest one is to you.
That's great. Thanks very much for talking to me, Owen. Have a great day.
And you, thank you.
That's Owen Winsland there, the mental health triage car manager in the urgent care division at Merseycare.